Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan for our weekly update on the COVID-19 pandemic. One challenge we have had throughout has been the vaccine distribution, the registration system. As early adopters of the state registration system, we realized that just were a number of things that just didn't really work out for us. So with 24/7 work done by our health department, Dr. Bogan and her team, the county's IT department, and our county stats, a new registration system is going to be launched next week. And I want to thank Dr. Bogan. I want to thank Jason Ditzenberger, our CIO, and I want to thank Joanne Forster, the head of the county stat department, and the teams that really worked on this. So the new registration system will allow residents to pre-register so that they can be notified when the clinics open for which they are eligible. They will prevent people from registering for clinics for which they are not eligible, which has been one of the biggest issues we've had to deal with, resulting in the cancellation of appointments, and allow one-time use links for clinics that are targeted for specific populations such as healthcare workers. So in advance of that, the links released for appointments through April 2nd, work being done in advance of the launch of the new system. Online registration for clinics will end at 9 a.m. this Friday, and phone registration through the 211 system will end at 5 p.m. Once the new system is launched early next week, we will announce and provide info for public to begin pre-registering, with new clinics being made available shortly thereafter. And we appreciate people's cooperation and help with the vaccine distribution system as it's becoming more and more robust. We have over 550,000 shots in arms here now in the county, over 190,000 people who've had at least one shot, and almost as many who have been fully vaccinated. And that will obviously continue to ramp up as time goes on. The alarming thing that we're concerned about is the case rise, and Dr. Bogan will certainly talk about that. We're getting close, folks. We're a month or two away. We just got to keep the masks, the distancing, the things we know what we need to do, and prevent what I would call a third spike that would lead to not good consequences for the folks here in Allegheny County. But let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan.
Thank you, County Executive. Good afternoon, and thank you for joining us again today. Our case counts in Allegheny County are on the rise. This week, our 7-day rolling positivity rate increased from 6% from 5.4% last week. The 7-day rolling daily case count also increased, particularly if you include both confirmed and probable cases. And unfortunately, hospitalizations have also started to increase. Like what we experienced in June last year, the median age of cases fell by nearly a decade over the past few weeks and is now in the low 30s. This change was largely driven by a 6% increase in cases among those ages 5 to 18 and a 10% decline in cases among those aged 65 and older from January to March. I presume that this large drop in cases in those 65 and older is due to efforts to vaccinate this high-risk group. As of last week, more than 65% of those 65 and older in our county had received at least one vaccine dose. From our case investigations, we hear that people are gathering with friends in larger groups than even a few weeks ago. And many of the gatherings are without masks. There are large groups at many different establishments and less physical distancing than is recommended. Simultaneously, we know that variants are present in the county. So far, there are at least 33 known cases with the UK variant. This is just the tip of the iceberg, since fewer than 1% of cases undergo genotyping to determine variant status. The UK variant is estimated to be about 50% more transmissible and somewhat more likely to result in hospitalization. As we approach the upcoming holidays, we all want to gather with friends and family. Given the rise in cases and variants in our community, I ask that we all continue to limit our gatherings to small groups, to wear our masks, to stay physically distant, and to continue to wash hands. It's essential we continue to test, isolate, and quarantine according to CDC and state guidance. The health department continues to work diligently on our vaccination plans. I'm pleased to announce that starting immediately, our county vaccination sites will accept all those with phase 1A eligible conditions. The lower age limit, either 16 or 18 for those 1A eligible sites, those 1A eligible, will vary by which vaccine we are giving at each site. Last week was our final week for our daily clinic in Monroeville. Thank you to our team who opened this site at the end of December and provided some of the very first vaccinations in our county. Over the 2.5 months we were there, we provided over 37,000 vaccines. I want to assure all those who received their vaccines in our Monroeville site from March 9th to 13th that we will hold a second clinic event at the Monroeville Convention Center, which is next door to the DoubleTree, on Wednesday, April 14th, to fulfill our commitment for second doses. Those impacted will receive an email invitation to sign up for this clinic next week. On Monday, our team opened a site at Central Baptist Church in the Hill District. Our thanks to Reverend Grigsby and his team for their hospitality and to Duquesne University for their partnership. We have had a successful first few days and we look forward to serving the community there. We continue to work with the University of Pittsburgh, who are vaccinating at the Peterson Event Center this week. Thanks to Pitt for their partnership and stepping up to help us provide doses these last 2 weeks. Today, we opened our clinic at the Ross Township Community Center, where we are working in partnership with the Ross Westview EMS team. And we continue to operate our clinic at the Castle Shannon Fire Hall in partnership with Medical Rescue Team South, the Red Cross, and Allegheny County Emergency Services. Since opening on February 16th, this site has already provided more than 18,000 vaccines. And we continue to work on implementing plans for other sites. We are very close to finalizing the details for a site in the Mon Valley and are pursuing opportunities to provide vaccines in the western part of the county. As the county executive mentioned in his opening remarks, we are in the process of bringing online a new, more effective registration tool next week. Once we're up and running, we will be able to pre-register anyone who's interested in receiving a vaccine. I'm confident that scheduling will be more user-friendly. Also have some positive news regarding vaccine efficacy. As of March 17th, out of more than 74,000 fully vaccinated individuals in the county, we have had reports of only 31 breakthrough cases of COVID-19. A breakthrough case means that someone had a positive test for COVID-19 14 or more days after their final dose of the vaccine. And of those 31 cases that we know of so far, 3 were hospitalized. I want to emphasize that this is preliminary data and likely an underestimate. Additional vaccinated people may develop infections over time. The chance of this increases as the variants become more common locally, which we have already seen. We will continue to follow these data closely and report out as we can. I also want to bring to your attention a treatment for COVID-19 that you should be aware of. It's called monoclonal antibodies. Monoclonal antibody treatment is given in an outpatient clinic through an IV needle in your arm. Research studies show that it may keep COVID-19 symptoms from becoming severe. People who receive the treatment are less likely to get sicker, leading to an emergency room visit or being admitted to the hospital. This treatment is available to higher risk individuals who test positive for COVID-19 and are within 10 days of symptom onset. In addition, to qualify for this treatment, you must be either 65 or older, or ages 55 to 64 with heart disease, high blood pressure, or lung disease, or ages 18 or older with diabetes, immunosuppression, kidney disease, or be obese. It's important to note that if you get this treatment, you must wait at least 90 days to get your COVID-19 vaccine. A number of centers across the county are offering this treatment. We will post links to these providers on the county COVID-19 website by tomorrow, or you can call your primary care provider for a referral. Just a few reminders. Please arrive for your vaccination appointments no more than 15 minutes ahead of time. If you don't know your appointment time at a county site, please check your email confirmation or call 211. If you were vaccinated elsewhere and you no longer need the appointment you scheduled with the county, please cancel that appointment so that the dose can go to someone else. For those of you who are fully vaccinated, and that is a growing segment of our community, please remember to wear your masks when you're with other people who may not be vaccinated. Practice physical distancing and follow other prevention measures, especially if you're visiting with high-risk individuals. And there is a long list of guidance on the CDC webpage for information about what you should be doing. So with that, thank you for your attention. Please stay well and be kind.
The first question that we have today is from WESA. With this rise in cases, do you think it makes sense to relax certain mitigation restrictions, like allowing bars and restaurants to operate at higher occupancy levels, or does this move seem ill-advised considering recent trends?
So mitigation measures were put in place early on and continued to really reduce the burden on hospitals, deaths, and we continue to monitor those, as you know. But if people took really individual responsibility and remember that this virus can be dangerous even for young, healthy people. The vast majority get it, they get over it. But we don't know why some people continue to have pretty significant problems from this infection. And I will say that lately there have been a lot of good reporting about long hauler outcomes, people who have the symptoms for a long time. There's been articles about the neurologic impact of this virus on people's health long term, including episodes of acute psychosis and other really serious conditions. So when people go out, if they follow the mitigation guidelines that we have in place, we will be fine. But I really ask that people take individual responsibility to prevent the spread of this virus, and not that assume that it's just like a cold and they're going to get over it. It can be a very, very serious illness. And as you know, we've had more than 500,000 people in this country die from the virus, but then we have lots of people who've remained ill for a long period of time. So again, individual responsibility and control will help us from spreading this virus unknowingly to other people.
This is a related question from KDKA Television and several other outlets as well, but with these restrictions being lifted on April 4th, what's your message to the public? I think you just covered most of that, but also will the county be monitoring these numbers and potentially pull back or add restrictions again if we do see a surge?
Well, as you know, we follow the numbers every day and we report them out to you every day. The most important thing is that people continue to keep their group sizes small, that they meet outdoors whenever possible, and the weather has been glorious the last little bit, so that opportunity is better for people to keep physical distance and to continue to do all the things that we're doing at this time.
This next question is from Print. Can you tell us whether any of the recent spike in cases seem to be related to St. Patrick's Day parties?
We have started to receive some case reports about people who attended events related to St. Patrick's Day, for sure, yes.
This next question is from WTAE. There is a rise of about 500 today in the numbers. Can you speak at all about whether that is connected with the University of Pittsburgh at all?
So as I've alluded to, there is wide community spread, meaning that these cases are coming from lots of places, not one place, not one business, not one university, not one type of location. It's really wide community spread in every kind of setting you could imagine.
This is a related question from WPXI. Pitt officials reported large gatherings the last 2 weekends, leading to concern of a spike in cases there on campus. Is the county aware of any enforcement of mask mandates by police?
Yeah, that kind of information is not reported to the county, so I'd refer you to the Pitt Police for that information.
This next question is from the Tribune Review. With today's numbers, Was there a reporting lag or any particular reason for the high number that you can point to?
Wide community spread. There really was not a delay in reporting. There were only 13 test results that are older than a week in the data we reported today.
This next question is from public source. With local COVID case numbers continuing to indicate a significant ongoing public health challenge and the CDC order that restricts evictions set to expire March 31st, is the county administration considering any action to further constrain evictions beyond the end of this month?
I'm going to let our county executive answer that.
The county has no authority to deal with this type of authority, this legislation. The CDC has the emergency order that is expiring. So again, that's something that the federal government has put in place, and county government has no authority. But what the county and the city of Pittsburgh have done is they've partnered together, providing nearly $80 million in funding for renters to assist with rent and utilities. The program opened on March the 15th, and to date we've received over nearly 3,000 applications. So we're working on those. Online applications are available at covidrentrelief.alleghenycounty.us, or you can call Action Housing, who's managing the program for the city and the county, at 412-248-0021.
This next question is from WESA. Can you give an update on vaccination campaigns at senior high-rises?
Yes, and that's been a very robust operation. And to date, the McKeesport Housing Authority buildings have all been done. The City of Pittsburgh Housing Authority buildings have all been done, and the Allegheny County Housing Authorities all have been done. And there are many private buildings as well that have also been gone through, and people have done that. To date, the county health department alone has given out over 900 first doses, and over 450 people, almost 460 people have been gotten both doses of the vaccination. So 24 sites have been done to date, and there are 13 more sites that are going to be planned in the next week or two.
This next question is for WTAE. It's from WTAE. As we have more mass clinics are finding areas that have unfilled appointments, would you advocate for a further expansion of vaccination groups?
We are currently, the state is at phase 1A, which we are continuing to complete. And as I mentioned in my remarks, at the health department, we had started with 65 and above, and then last week we went to 50 to 65 with 1A conditions, and we're going immediately to all of 1A, phase 1A conditions. And we are waiting for the state to move to 1B when the data indicate that we're ready to go there.
This final question is from WESA. Do you think it makes sense to vaccinate as many people as possible, as quickly as possible, in order to quickly achieve herd immunity? Or do you think it's better to go a little bit slower so as to target vaccinations at marginalized, at-risk, and vulnerable populations?
So first of all, we are getting all the vaccine that's coming into the county is going into arms very quickly. So there's no delay. And we're using both tactics, right? We're doing many large events across the county, and we're also doing smaller events to reach those higher risk, like our events with the senior buildings. And so the vaccine is getting out quickly and efficiently, and we're using multiple strategies to do that.
That was the final question. If there was any closing remarks.
Thank you, Dr. Bogan, and again for your team and all the folks that are working on the new registration system, as well as doing the contact tracing, the case investigation, as well as the vaccinations. And a lot of partners are really helping out in doing this. I mentioned these county, city, and city of Pittsburgh and city of McKeesport housing authorities. They were not done only by the county health department. There were a lot of partners that were involved in doing the various neighborhood applications, and folks that might not have the ability to get to some of the sites, to the pharmacy, to the hospital, the other places that are happening. So there's going to be more things coming up in the coming weeks, and stay tuned. You hear the announcements at the national level that there's going to be an increase in vaccines that will be available. Looks like in the month of April, but it remains to be seen to what level. Everyone that I've been to many of the vaccination clinics, and people are very, very cooperative, very helpful. Our volunteers, the folks who are injecting, putting shots in arms, people are checking people in, the people are leading through on traffic and parking and all the different things. It takes a whole lot of folks to do the logistics of getting the 1.5 million people or more that we want to get vaccinated in the coming months. So again, the other thing that I think is important is we do see these cases rising again. As Dr. Bogan said, it's not just the hospitalizations and fatalities, which obviously are the most dire things, but people are getting this illness, and it's lasting for a long time with certain people. And while they may not be hospitalized, it's certainly affecting their life, their quality of life, their ability to do things. So be careful, wear your mask, stay distant. If you haven't been vaccinated, continue to do the mitigating strategies. The variant is out there. It seems to be more amenable to spread quicker than